Hi parents, if you are seeing my video, most probably you are here to find out what is the hydronephrosis or pelvic ureteric junction obstruction. Perhaps somebody you know are having. Let me just explain to you what are they. So sometimes your pediatrician or your obstetrician, when they do ultrasound, they would have pick up this and they would have explained to you. So let me just explain to you. In a normal, you have your kidney which produces the urine. It goes into the collecting system and then it goes down smoothly into the bladder, right? So there is no obstruction at all. Everything is consistently going down smoothly. Now, when you have a hydronephrosis, so hydronephrosis essentially means that there's a swelling near the kidney, all right? Hydroureter means there's a swelling down here. But if your child only or somebody you know only has hydronephrosis, it means that there is a block around here which is causing the swelling. So this is what we call pelvic ureteric junction obstruction. This is pelvis, this is ureter, there's an obstruction here. Okay, now why is this very important for you to understand? A pelvic ureteric junction obstruction, after that we have to do a MAC3 scan or a DTPA scan. We want to see the differential function. Both kidneys contribute 50% and 50% function for cumulative 100% function. But if one of the kidney which is affected in your pelvic ureteric junction obstruction has reduced in function, that is an indication that the child needs a surgery to relieve the obstruction. Because if you don't do the surgery, the back pressure will eventually destroy the renal parenchyma, and that will eventually lead to that particular segment of the kidney to fail. We want to avoid that. So what do? We go in, we resect the obstruction part, remove it, and then we connect it. All these are done laparoscopically in a minimal invasive technique where the child doesn't suffer so much, not much pain, minimal scar, and faster recovery. Naturally, we'll put a tube in between when you're doing the connection so that the connection doesn't get smaller. Then usually about 6 weeks to 3 months, we'll remove the tube. Generally should be quite safe. Okay, I hope you'll understand about pelvic ureteric junction obstruction. If you have any question, do text me. My numbers is below. Okay, bye.